Well, good morning, everybody. Today is Wednesday, April 22nd. We're at about 11:15 in the morning as we're recording this. I don't know when you'll have the opportunity to see it, but I want to let you know where we are in time as we present you the most up-to-date information that we have. I want to start out by thanking Dr. Rocco and the Hamilton Township School District for having us back at their building to be able to provide you a joint update on where things currently stand, both with the Township of Hamilton and our school district, and as well thank Cathy Fitzgerald, our Director of Health, Recreation, and Senior Services, for joining us again as well. First few things, you may have noticed I have my green tie on today. Today is Earth Day, so hope on this beautiful day you all get an opportunity to go out and enjoy some nice, although cool, but nice weather outside, and also happy Administrative Professionals Day. I know from the township side, our administrative professionals keep us going each and every day, keep things moving so we can keep serving you, and so want to give a shout out to them as well. So where we are right now in Hamilton, as of this morning, we have 621 total positive cases. Out of that, we have 170 who have fully recovered. So that's great news, knowing we have 170 people out of those 621 who have fully recovered, and those are closed cases. Unfortunately, as of this morning, we have 41 people who have passed away from a COVID-related illness. And so our thoughts, our prayers, our condolences go out to all those individuals, their families, friends who are having a difficult time, I'm sure, dealing with that, especially with everything else that's going on. So again, to those families who've lost a loved one, our condolences go out to you. Out of those 41 deaths, though, one of the breakdowns we're seeing is every one but two. So all but two of those 41 deaths have been people aged 60 and above. So it really shows you here in Hamilton the disparate impact it's having on our senior community versus people who are under the age of 60. And even one of those who are under the age of 60 was a 58-year-old. So you can really see the difference on how COVID impacts those in our senior community versus those who aren't seniors. So that's where we presently stand today. From the Mercer County viewpoint, yesterday, Tuesday, April 21st, was the highest recorded day of total number of new positive cases in Mercer County. I believe the biggest reason for that is an increase in testing. We have a number of test sites available. We'll have Cathy go over all the places people can get tested. But what we're seeing is obviously Mercer County, thanks to County Executive Hughes, opened a test site at Quaker Bridge Mall several weeks ago. Mayor Freed in Robbinsville partnered with a medical provider to open 3 days a week a testing center in Robbinsville. Mayor Gussiora has partnered with a healthcare provider to open some test centers in Trenton. And again, as Cathy will tell you in a little bit, some of the private providers who are also providing testing. So that shouldn't be a shock as we continue to see numbers at or near some of those peaks. But the primary reason behind that is, in my personal opinion, we've just seen so many more tests being performed, which is a good thing. So we get a clearer picture of where things currently stand here in Hamilton as well as in Mercer County. But you'll continue to see relatively high numbers, I think, in the county over the coming days or week as we continue to perform more and more tests each day. Some of the things we're doing presently in Hamilton that I particularly want to highlight before we get into some of the other stuff. PPE. The town has bought thousands of surgical masks that we've started to distribute out to our seniors out to our essential businesses, those who may not have access to them otherwise. To date, as of today, we'll have distributed over 4,500 masks to senior citizens. Primarily how we've been able to do that is through our senior center, those that are signed up there, and through the 55 and up communities for distribution through their boards. We are expecting an additional shipment of about 8,000 masks today, and are currently finalizing plans on how to distribute them to seniors who might not live in a 55 and up community, might not be part of our senior center. We want to make sure our seniors, especially those with underlying medical conditions, have access to masks. Again, seeing those numbers, the percentage of those mortality numbers that we talked about earlier, we want to make sure those people especially have access to our masks. So we continue, again, to finalize those plans to get them out to our senior citizens. If you need a mask urgently, we'd ask, if you need it urgently, you can reach out to us via email. Email us at mayor@hamiltonnj.com. But know that we are going to be finalizing soon a mass distribution program for the seniors who might not have otherwise got any. Also want to thank a number of companies here in town who have donated PPE. Salvona here in Hamilton is a skincare and perfume industry. They've actually transitioned a lot of their manufacturing over to hand sanitizers. And just this past Friday, they donated 400 bottles of hand sanitizer to Hamilton that we've been then able to distribute out to our police officers and to those employees who are still engaging with the public doing inspections or the like. So really want to thank Salvona for all they've done for us. Also want to thank Olden Pharmacy. Olden Pharmacy just yesterday donated 500 surgical masks to the township that, again, we're using to get those masks distributed out to senior citizens in our area. So as you can see, there's a lot of companies, there's a lot of individuals who have really stepped up and are helping all of us get through this together. And I know Dr. Rocco will talk a little bit even about how the schools are contributing as well to make sure we all have, and our first responders and all of our essential employees, whether you be working at a grocery store, driving a truck, working at the pharmacy, all our essential employees have the PPE they need to keep them and their families safe. So really great things coming out of Hamilton. Also want to talk about an event that'll be going on this Thursday evening, April 23rd. Some of us are going to be going to Robert Wood Johnson. That is an invite only to Robert Wood Johnson Hospital. And what we're doing is echoing our appreciation for our healthcare workers, those who are on the front line 24/7, really helping each and every day save the lives of people in our community. And I, along with Dr. Rocco, the leaders in Mercer County, Robbinsville, and East Windsor, along with Mercer County Sheriff Jack Kemmler, Mercer County Prosecutor Angelo Onifrey, really going there to show our appreciation, along with the police and fire departments of those respective towns as well. What we're asking all of you to do, since you can't join us at the hospital, to make sure we're complying with our social distancing requirements, we want you to engage in our Front Porch Project. Our Front Porch Project is an opportunity for you all to amplify what we have going on at Robert Wood Johnson. So at 7 o'clock on Thursday, April 23rd, we want you to go out of your window, go out on your front porch, whatever means you have necessary to hoot and holler, to bang some pots and pans, to clap, applaud, and just really show your appreciation to our healthcare workers especially, but all our essential employees and those on the front lines. We really want to see what you all are doing as well. So please post to social media, please tag us, please send them, again, to mayor@hamiltonnj.com. We'll compile the photos, the videos, and we really want to share it because we know how great our residents are here in Hamilton, how great the residents are here in Mercer County and appreciating what our medical professionals are doing for us. And we want to amplify that, we want to echo that, and we want to show the world how great Mercer County and specifically Hamilton is. So again, this Thursday, April 23rd at 7 o'clock, go out on your front porch, go out to your window, and really show our community how much you appreciate everything that our hospital workers are doing for us. And want to give a special thank you to Robert Wood Johnson for letting us have this event on their campus so we can show everybody how much we appreciate them. With that, I know many of you are hearing about funding coming from the federal government. Just about 2 weeks ago, 2 to 3 weeks ago, the president signed the Bipartisan CARES, C-A-R-E-S Act, which provided about $2.2 trillion in funding to various groups and organizations. Hamilton has already received confirmation that we are going to be getting about $450,000 of that money. But I want to explain that money is geared towards certain specific things. $50,000 of that money is geared towards our law enforcement and making sure they're able to purchase the PPE equipment that they need and that any overtime or additional duties that they need to take on are compensated by the federal government and don't go on the taxpayers here locally. So appreciate our federal representatives, Congressman Smith, Senators Booker and Menendez, and the President for getting that bill through. So that's $50,000 roughly of the $450,000. The other $400,000 is what's called Community Development Block Grant funding. That funding also has very specific purposes. So what the town can use that funding for is things like additional testing, additional personal protective equipment. There are also provisions in there for us to help local businesses who are engaged in the healthcare industry and making sure they have some of the capital they need to keep doing what they're doing. So we're at the township level putting a plan together to coordinate those funds, get them approved by the federal government, and get them distributed out to those who need them right away. Again, very thankful to our federal representatives for getting us that money. And we're really looking forward to continuing to work with them because we know our state, our county, and our local municipality, both from the township and the school side, need that additional funding for the additional expenses we've had to put out as well as to respond to this pandemic. And again, want to thank Dr. Rocco for having us here today and doing another video series, our third. So Dr. Rocco, what updates do you have from the school district?
Well, good morning, Mayor and Cathy. It's nice to see both of you, and thank you for continuing to do this. I think this is an important way to get some information out from the Township and the Board of Education. I appreciate your time in these very busy circumstances and these busy times. So a couple items I want to go over first. Let me start with Spirit Week. We're on our second Spirit Week as a school district, and it ties in specifically with the work that's and the event that's going to happen Thursday with Robert Wood Johnson. So Thursday, we're going to do Throwback Thursday. So, and Mayor, you're always welcome to participate. Cathy, we're going to be putting pictures up from when we were kids, and students can guess who's who, but doing some old-time pictures, baby pictures, graduation pictures, and things like that, kind of to get kids interested in what it was like for our teachers and our principals and our administrators growing up. But the piece that ties to Robert Wood Johnson is Friday. So Thursday, you're going to kick off with the celebration at the hospital and then the celebration at 7 p.m. in the community. On Friday, as our Spirit Day, our Friday is Frontline Heroes Friday. And what we're asking our school community to do, and the community at large to do, is to write a message to our frontline heroes. So our nurses and our doctors, those working at the grocery stores, those driving the trucks, those that are out on the front line at the restaurants, making sure that food's still being served. We have many heroes in our community that are making things happen and keeping things working over this period of time. So I think it's a nice connection between Thursday night's events and Friday's theme. And what we ask the community to do is, when you create those pictures and those messages, to put them on your social media feed and then put the hashtag HTSD has spirit, one word all crushed together as the hashtag, and also to tag our Twitter account and our Instagram and our Facebook account, which is We Are HTSD, and the R is spelled out ARE. So I think that's a great connection, keeping spirits up, celebrating those that are out there working every day to make sure that we keep moving forward, those that are protecting us, those that are working to make sure that the stores are stocked and things keep running. So I like that connection, and thank you for doing that as a township. And we continue to do our Spirit Weeks every couple of weeks. And it's been a lot of fun this week. Yesterday was our favorite sports jersey, and on that I took a little bit of ribbing because I'm a Yankees and a Giants fan, and I know I'm in Phillies and Eagles territory, but it's a good way to keep up the spirits. Second item I have for you is there's a lot of questions around the class of 2020 and graduation. And this is something that we take very seriously. And I want our graduating seniors to know, and their families to know, that this is important to us. It's not only important to them as they graduate, that we find a way that we can celebrate their years at Hamilton Township and their graduation, but we have to find a way to do that within the parameters set by the state and the federal government. So we are coming up with lots of different ideas of how we could run a graduation. Do we run a graduation on the graduation day? Do we do something different on that day or something later? All of those things are being talked about right now because we understand the importance of graduation. We also understand the importance of many other celebratory events that happen for our seniors and our juniors and our fifth graders going to sixth and our eighth graders going to ninth. And my administrative team is working on all of those different options. Those options really are based on what we're allowed to do. What are the health restrictions that are put on us, and what's the safest thing to do for students and adults? We do not want to put anybody in a health risk by developing something that really would not be good for people to come together or to do as a group. So obviously we're going to be paying attention to the information that the governor puts out, what the health department for the state puts out for the county and locally, to make sure that we abide by all of those rules that are in place, that are there to make sure that people stay healthy and safe. So we are still talking about that. But we will have some ideas coming up in the very near future. One of the things we are doing, and this will be the second year in a row that we're doing this, and we are going to continue that, is the class of 2020 HTSD Decision Day. So our students, when they make the decision, are they going to college? Which college are they going to? Are they going into the military? Which branch are they going into? Are they going into some kind of trades training or work in what they're going into? That's their decision day. And what we're going to be asking them to do is take a picture of themselves and with a sweatshirt or a t-shirt of the school or the military branch or what they're going to go into as a trade or business, and send it to us, and there'll be more information on that coming out to our seniors. And then we put a montage together of our students by school, and that's our Decision Day celebration. All of our students are moving on to something as their next step as they become adults. And as I said, there are 3 different ways that they can go: college, career, or military. And so we want to celebrate all 3 of those. We did that last year. It was fun. Last year we actually got everybody together. At 2 of the 3 schools, we were able to fly a drone above them, and it got them as a big group. This year we obviously can't get them together, but we do want to celebrate all of their decisions. So information is going to be coming out about how we're going to celebrate the decisions our seniors have made, and then we'll put that out on social media. We'll put that out on our TV station, and some other ways that we can get that out to the public to see what's going on. I'd also like to thank a number of our different groups within our school district that have been also giving some PPE out to hospitals and organizations, and specifically the Innovation Lab at the Spartan Library at Hamilton High School East at Steinert. Their initial run on the 3D printer was 80 face shields that they donated. And then last week they were able to donate another 150 shields. And so they're producing those off of their 3D printers. And that's an exciting opportunity for our students to actually put some of the skills that they're learning in the classroom into practice that actually have real world use. So I want to thank them for that. And I know that we have some of our other organizations across our district that are donating different things to different organizations. The district donated a box of masks to one of our local pediatricians who was out of them about a week or two ago, and we continue to help out any way that we can. But I want to give a shout out to our students who are putting those 3D printers to use. The other thing, we did food distribution yesterday, so I want the public to know that every Tuesday we will do food distribution at 6 sites. All 3 of our high schools, Nottingham, West, and Steinert, will have food distribution. Then at Cooser, Sunnybray, and Wilson Elementary Schools. And that will always be from 10 to 12 each Tuesday. Yesterday, we were able to provide 5 days worth of breakfast and lunch to over 2,100 of our students. I want to thank the volunteers who were both employees of the Hamilton Township School District and volunteers from our community. Thank you for always coming out and helping us with the food preparation and the food distribution. It helps us immensely. One of the things we instituted last week in conjunction with conversations with you and the police chief was a drive-up feature. So again, one of the things I mentioned the last time we did a video was the interaction and the collaboration between the township and the Board of Education. And I want the public to know, and I also want to thank you because that's continued from the very start. Hand in hand, we talk often as needed, sometimes multiple times a day. But the police chief had recommended us looking into a drive-in feature that would allow for us to continue social distancing while those who were coming to pick up meals were in their cars. And we set that up. The police department looked at our plans, made a couple of good suggestions on how that would work. We did it last week. It ran very efficiently. We did it this week. It continued to run efficiently. Almost every one of our families picked up by car. We had a select group of families that lived within the community of where the schools were, and they came in. We still have a drive-in feature, a walk-in feature. On that walk-in feature, we have marked out 6-foot spaces on the sidewalk for community members who walk up to stand and walk line to line until they get to the front. But it's a very small group of people. Everybody else is coming through cars and picking up, and that's been very successful. So next Tuesday, we'll continue that again. We'll continue our food distribution throughout the rest of the school year. The final thing for this segment I want to talk about is that we continue also with device distribution in the school district. One of the things that happened early on is when we did a survey with our students is 83% of our students had Wi-Fi and devices in their homes. We then increased that to 87% with our first set of distribution. Right now, as we're taping this right outside of this room, we're doing our next distribution of Chromebooks for our students. We are now at 98.5% of our students with a device and able to connect online. The remaining 1.5% of our students will still receive a paper packet, and that's going out today and tomorrow. And we're working with a local vendor to get that produced and sent out so our staff no longer has to come into our buildings. Our goal is still 100% if possible, if the community member has Wi-Fi at home. But what we're also seeing, and what I want to let our community know, is that you may have come and picked up a device with us, and we're considering one device. A family now has a device, so that's why we're at 98.5%. But you might have 3 children at home, and you may need a second device. If you need a second device because you have multiple children, and we have that through our system, you can and you are eligible to come up and pick up another device. We don't want our students and our families having to arrange times of mom or dad or guardian having to do work from home on a device and then have to get off of that device for a student to do schoolwork. If you need multiple devices, you have multiple children at home, we've done some of that also to make sure that our students can be connected from 10 to 2 when our teachers often are doing video lessons, going online and doing online check-ins. The other thing, and the last thing that I'll close with that's tied to the device distribution, is the further we go along with our remote learning, the better we all become with it, right? Something we have not done before in the past. Our teachers and our staff have risen to the occasion. Again, I want to sing their praises for the hard work that they've done to make sure that this remote learning works as best as possible in these circumstances that we've been provided. But as we move forward with this and we do this longer, we're also modifying remote learning. So our parents and our students will see our teachers coming online more and more, doing live check-ins, doing live lessons, doing live group discussions with our students more than they've done before. And so as we begin to make those transitions, I will put that out in the weekly newsletters that I put out to the staff and to the community. And for our community to know, those daily updates to the community that were Monday through Friday transitioned 2 weeks ago to Monday, Wednesday, Friday. So every Monday, Wednesday, Friday between 2 and 5 o'clock every day, we will post that on our website and send that out through social media.
Thank you, Dr. Rocco. Again, appreciate the updates from Dr. Rocco, and I think he really talked about the collaboration that continues every day between the township and the school district, and really helps make this town better and the services overall that we provide you more efficient, as you just heard about with the food distribution. And want to give a shout out to Chief Stevens of our police department for him and his team making that a little bit more efficient and really safer for everybody that's involved in it. So now I want to turn it over to our Director of Health, Recreation, and Senior Services, Cathy Fitzgerald. And Cathy, one of the first things I'd like you to talk about, building on that collaboration, is the Pen Pal project that we'll be establishing.
Sure. Again, thank you, Dr. Rocco and Mayor Martin, for allowing me to be here today. The program that we had spoke about at our last meeting was having a Pen Pal program between our senior citizens and the youth of the township. A great idea, but how to make it happen is something that our staff and your staff have been working with to get that off the ground. I'm proud to say that beginning on Monday, April 27th, we are going to get that program launched. Our seniors will be receiving their email from our staff to notify them of the topics that they can choose to write to our students, and our students can do the same. And we'll be exchanging those letters through an email server. And I think it's going to be a great win-win for everyone. So again, thank you for that cooperative program.
I think it's going to be awesome. It's very exciting for our students.
Cathy, if more seniors who maybe aren't part of your senior center want to get signed up, either for that or some of the other things we'll talk about, can they do that?
Sure. Well, they can certainly email us at the Senior Center, and they can also call our number, which is 609-890-3686, and tell us what they're interested in, whether they're interested in joining the Pen Pal program or some other programs that we're having now, or perhaps they're interested in becoming a participant in the Mercer County Nutrition Program. They can call to get that information. They can come to the Senior Center 5 days a week to pick up a meal once registered with the county.
Okay. And what are some of those other programs you have going on still at the Senior Center, even though people can't physically be there?
Right. So obviously the nutrition program is a very big program for our seniors. They come to the facility to pick up their meal every day between 10 and 12. And those that still ride the trade buses, and since they no longer are running them, will have their meals delivered through trade by the drivers right to their doorstep. Along with that, Mayor, we were able to give out the surgical masks to every participant, which they very much appreciated. Some of them did not have the ability to make masks, but we're very grateful that we were able to give them. And they received them not only with the meal at the center, but also the meal when it's delivered. So that's been helpful.
That's awesome, Cathy. So earlier we talked about the mortality rate we have and how much that disproportionately affects our seniors here in town. Can you just talk a little bit? I know the long-term care facilities are actually regulated by the state, but some of the actions we've taken here locally and your department's taken locally to assist our long-term care facilities here in Hamilton.
Sure. Well, Mayor, as you know, most of, at least 50% of our deaths are in long-term care facilities, and they are of individuals who are older, who have compromised immune systems, or they have chronic health issues, and that leads them to be more vulnerable to this type of virus. We also have the workers who have to come and go through these facilities, and sometimes they are carriers of these diseases. Even though they would not know, they may be asymptomatic and they're taking all the precautions, wearing the PPE, but somehow, some way, the viruses get through. We are making sure our seniors are well aware of utilizing protective equipment, washing their hands, staying socially distanced, and making sure that our long-term care facilities have all of the guidance that they need. They are regulated by the state of New Jersey. Local health departments help provide guidance during an outbreak. COVID is an outbreak, so therefore we constantly talk to our long-term care administrators, the director of nursing there. We receive daily reports of their census, of any positive cases, individuals with signs and symptoms. We also, the state regulates that they cannot take admissions at this time during an outbreak unless they can follow 4 rules. And those 4 rules are an outbreak plan. And in that plan, they have to make sure they have the ability to cohort. Cohort means to divide their clients or their patients into a sick area, a well area, and those who've been exposed. And with that, they also must make sure they have adequate staffing and proper PPE. And so our health department does that every day with every one of our long-term care facilities to ensure that they're following those measures.
Now, Cathy, again, a lot's been reported about long-term care facilities statewide as well. And from a law passed last year, these facilities have to maintain communication with the family members of their patients. But if a family member, say, can't get in touch with somebody at a long-term care facility, do they have a number they can call to get some more information? They
do. There is a phone number for any concerned family member to call regarding a long-term care resident. That number is 1-800-792-9770.
Can you give that number again, please?
Sure. 1-800-792-9770.
Thank you very much. We talked a little bit more, or we talked a little earlier about testing and how, Mercer County had its highest day to date as of yesterday, and my personal opinion is that's because of the increased testing. So if somebody thinks they may have the virus or may be showing signs and symptoms, what are their potential options in regards to getting tested?
At this point, the CDC is still only recommending testing for those with signs and symptoms. And of course, the signs and symptoms are flu-like symptoms. The fever of 100.6, although testing sites are utilizing 99.6 at this point. Also cough, shortness of breath. There are other flu-like symptoms that they have been discovering when we do our surveillance, such as abdominal pain, nausea, vomiting, loss of sense of taste or smell, a few other items. And there also are those who are asymptomatic, who maybe had a fever but no other symptoms, and then they went and got tested and found out that they were positive. So some testing sites that are still available for residents to go to if they have a prescription from their physician is the Quaker Bridge Mall testing site. You do need to be 18 years of age and older, and that's up at Quaker Bridge Mall. And also another testing site here in Hamilton is the MedExpress Urgent Care on Route 33 in Hamilton. Again, they have a physician there, so you'll be evaluated and then tested if you show signs or symptoms. Same way in West Windsor, there's an In Focus Urgent Care that will do the same process. The physician will evaluate you and then do the testing. PNC Art Center in Homedale also has the testing site. And now primary care providers, some of them locally, do have the ability to do the tests, so I would recommend that you call your primary care provider to find out if they're able to do so.
That's great. So one of the things that I think we've been seeing is as this stay-at-home order continues to go along, is the additional stress, the additional anxiety that it places on people who may not have had any stress or anxiety before in their lives, or very little. So those that are feeling that stress or that anxiety or an increase in it, what are some things they can do?
Well, stress and anxiety from the fear of the unknown is something that gets all of us. And none of us can be certain that we haven't been exposed, because when you're out there in the public, even with your face covering, you do have the potential to be exposed. So you go home, you get a tickle in your throat, you cough, you start to worry. And that worry can create a lot of anxiety. There are mental health hotlines that our residents can call, and I can give you a number for that if you'd like, to talk to someone 24 hours a day. It also does have the language interpreter there, so if you don't speak English, it's able to provide guidance to all of our residents. The number for the mental health hotline is 1-866-202-4357.
And I know you've given out a few numbers now. Are there any other numbers that people you'd want people to have should they have questions, concerns about anything related to the COVID-19 virus or some of its impacts that it's having here?
Sure. Well, the 211 number is the number that everyone can call for information on the COVID. And also they can go to the state website for the COVID-19.nj.gov and get more information. That also lists all of the postings of the breakdowns of our counties and the cases that are there.
All right, so thank you very much for sticking with us. A few more things that we want to talk about. Cathy, you had mentioned earlier about the monitoring and some of the things your nursing staff at the township is seeing as they do monitoring. Can you just explain to people what happens when you get a positive case in and the steps that happen from that point?
Yes. So when a positive COVID test comes in, it goes through the CDRSS, and that's the Communicable Disease Surveillance Reporting System from the state that comes down to our local health departments, no matter what municipality you live in. Our public health nurses are responsible for communicating with the resident that positive test came in on. With that being said, every resident is contacted. Those who may be in the hospital, hopefully we reach their family member. We do a complete report, or surveillance as we call it, contact investigation, to find out what their case was, what symptoms they had. Were they in direct contact with someone who was a known positive? Did they travel somewhere where they may have been in contact with us? Very important surveillance is, are they a healthcare worker? We want to make sure that we've monitored contacts for that to prevent the transmission of the disease. Our nurses follow through with every one of those cases, and it is a daunting, difficult task. They speak to all of our worried, all of our positive cases, family members, even those residents who have lost loved ones, going through all of the trauma associated with this disease and the anxieties, as we talked about before. They are the most compassionate people I have had the pleasure to work with, and their professionalism is amazing. And I'm very proud of them, and our residents should be proud of them for what they do every day. And they follow through all along to find out if this patient recovers. And then at the end of the recovery period, we're able to announce how many people have recovered. And recovery is after they've met their isolation or incubation period and their quarantine, and they show no more signs and symptoms.
Awesome. And then also with that, that's how you get the names for any direct contacts that they may
Correct.
have.
And then that's a whole nother investigative report that you now need to follow every contact, direct contact, and that would be the less than 6 feet, greater than 10 minutes association with someone. And that's also very task-oriented.
Awesome. Thank you, Cathy. Dr. Rocco, I know you had some additional information you wanted to share as well with the public.
Sure, a couple other things. I want to talk specifically to our high school students. Students who are juniors who have to take the SATs and are also looking to do college visits. At this time, I encourage all of our high school students who are juniors and some of our sophomores that are getting an early start, reach out to your guidance counselors. Start looking at the colleges that you're interested in because they are doing virtual tours now. Check in with those colleges. Let them know that you're interested. Even though you can't go on site to see them right now, it's important that the college knows that you're interested in them, and it's important when it comes time for applications. The SATs have been canceled. The ACTs have been canceled through June. What colleges and universities will do as a result of that is still to be determined. There's some discussion that those tests will not be used for entrance into colleges and universities for the next class, the class of 2021. There's still a lot of question about that, but what I would say to you is do not stop your college search at this time. It's important for you to continue doing that even though you can't go on campus. Let the colleges know and the universities know that you're interested in them. Take their virtual tour. Go talk to an admissions specialist at a college or university. That's very important. When we get word about SATs and ACT tests and when they are rescheduled, we will let you know. The next group of high school students I want to talk to are the students who are in our advanced placement classes. And this is for the students and the parents. Parents, please encourage your children who are taking AP classes to take the AP exam. The exam will be offered at home, so College Board has that all set up. Reach out to your guidance counselors to get additional information. As we have done in the past, we will continue to do now. If you take the AP exam, the school district will pay for the AP exam. It is important for our students to take those exams because students who score a 3 or higher, 3, 4, or 5, are eligible for college credit when they enter colleges. Many colleges will give credit for AP scores 3 and higher. So please, you took the class, take the test to be eligible for a 3 or higher and potentially some college credit, which might save your parents a couple of dollars. Okay, so seniors, juniors who are AP, please do that. A couple other things. Nottingham has moved their junior prom right now to June 5th. More information on other junior and senior proms at our 3 high schools will come in a future date when we get more information from the governor. Preliminary pre-K registration information is out on the website, so parents who are registering their children for preschool and for kindergarten, information is going to be out there. I know a number of our parents have asked about the re-registration from 5 to 6, 8 to 9. We have not put information out about that registration yet. That will be coming in the very near future. And my final thing is, all of our families, all of our students, if you have an issue with remote learning, what I ask is the first step is to reach out to your teacher. And the next step would be to reach out to your principal if there are any difficulties, any problems, any issues that you're having for remote learning. And finally, again, a thank you to the faculty and staff of our school district for all the hard work that you're doing to make remote learning possible and keep our district running. And to our students and our families and our community out there, thank you for working with us during these difficult times. And as I've said many times before, if we stay together, work together, we will get through this together. So thank you very much. And to the mayor, the township, the police department, Cathy, and your health department, again, thank you for your collaboration too.
Thank you, Dr. Rocco. One other question I know people have is the governor's already announced May 15th as the no earlier than date for schools to reopen. Have there been any indications on when another announcement may come, one way or the other, on the remainder of the school year from that point forward?
No, and actually, the governor has been pretty consistent with his messaging, which is, I'm going to make a announcement at a certain time on a certain date, and he's usually within a day of that. And there's no indication in any of the meetings that I've had which way the governor is going to go. The only thing that I know is from yesterday's press conference, I think it was, he was very clear that his decision will be made on science and the data. So when he makes that decision on what we are going to do, it will be based on the environment at that moment and what that data tells him and his advisors what the future is going to look like. I will tell you from the perspective of the school district, we are planning multiple scenarios. We've been planning multiple scenarios for his April decision, and when he said he will make another decision in May, we continue on planning multiple scenarios from opening up shortly after he makes that announcement on the 15th, if he were to say that, or not opening up for the rest of the year, and anything in between. So we'll be ready for what he announces on April 15th based on the guidance he provides.
That's awesome. Appreciate, again, you and your team's collaboration and working together with us. A few other things that I'd like to talk about that we have going on here in the township, and just some personal thoughts. First thing, every day the township puts out a newsletter via email to everybody who's currently signed up for it. This is a great opportunity to get the latest information, not only on what's going on with COVID, but some ancillary things as well. And our team at the township does a great job of putting in some fun stuff, as well as putting in some important information, whether it be about unemployment or other issues that are going on in town. If you're not currently registered for that, I would strongly encourage you to do so. It's easy to do so. If you go to our website, www.hamiltonnj.com, you'll see near the top there's what's called About tab. If you click on that About tab, you'll see another tab where you can sign up for our email newsletter. We've been putting out those newsletters even on the weekends, and so really thank our team at Town Hall for working over the weekend and getting all that stuff so we can share with you the latest information that's going on here in Hamilton. Another thing I want to talk about is food banks. We know that so many of you have unfortunately lost your job, either temporarily or permanently, or been furloughed, and have some concerns about the ability to pay for food, and are turning to food banks to be able to help sustain you and your families through this time. Our two main food banks in town are at the Wilson Center near Hamilton High West, and at the CYO Bromley Center near the Hamilton Fire District there on East State Street. If you or your family think you need food, please contact either one of those facilities. They have designated days and designated times so that you can go and get food for you and your family. We've also provided those organizations PPE as well, so that food can be distributed safely to everybody who's going for that food. There are other food banks, many of them in Trenton, some others here in Hamilton, as you heard Cathy talk about the Mercer County Nutrition Program for seniors that they can sign up for. So there are lots of avenues if you are food insecure at this critical time for you and your family to get the food that you all need to get you through this time. I get a lot of questions about parks. A few weeks ago, the governor closed all state and county parks. Immediately thereafter, I closed all the municipal parks in town. And I want to explain why I did that. The biggest reason I did that is you could think about some of the state parks we have in town. Princeton Battlefield, Washington State Park, Delaware River Canal. You think about our Mercer County Park, specifically the one that's partially in Hamilton, of Mercer County Park, and how large those parks are. The next largest park that, at least again, I can think of is Veterans Park. And Veterans Park is our crown jewel here in Hamilton, and something I know we all take pride in having here locally that we can all enjoy. Previous to the governor closing those parks, our parks were pretty well occupied. We had lots of people there, some adhering to the social distancing, some not. Most people were. But you can imagine the influx of people we would have who then couldn't go to the state parks, who then couldn't go to Mercer County parks, and the strain that would have put on our park system to keep you all safe. And so that's why the decision was made to close the parks that we have. Obviously, Sayin Gardens, right now we'd be in the middle of preparing for the Azalea Festival, which is canceled. and how beautiful that park system is, but that's a tighter space. So you can imagine what would happen if people from other neighboring towns, instead of being able to go to Mercer County Park, now came to Sayin Gardens, now came to Vets Park, now came to Cooser Park. So that's why the decision was made to shut those parks. Once the decision is made to either open the state or the county parks or both, we'll be fully opening those parks again. So just wanted to explain that situation and my reasoning behind it to you all. You're going to be hearing a lot about blood donation, plasma donation, especially for people who have recovered, who now have these antibodies. One of the things that I pay attention to at the national level is when we'll have a rollout of what's called these antibody tests to find out about people who may have had the COVID and didn't realize it because they were asymptomatic, or people who had it and have since recovered. And there's some promise, early on at least, about being able to donate blood specifically from those people or donate plasma specifically from those people. Whether you've recovered or not, I encourage you, if you have the ability to donate blood, please go out and make sure you do donate blood. This is a critical time for those in our health field to get blood to those who need it. One of the things that we're seeing as a township, and I talk to our police chief, we have a call every morning between police, fire, OEM, and our health department and the administration every morning, is we're seeing a rise in domestic violence calls. Many of you are in the house all day together without an opportunity to take a break. Some of you are in an apartment, maybe a studio or a one-bedroom apartment, again, in a confined space with everybody. And it's only natural. You combine everybody in that closed environment. You combine the stress and anxiety that we talked about earlier, and that can lead to the potential for some unfortunate situations. And our police officers are still responding to all the calls that we get regarding domestic incidents or anything else. If you're feeling like you're getting some stress at home, take a breather, count to 10. If it's a nice day, go for a walk around the neighborhood. Just get outside that house, that apartment for just a few minutes and let some of that stress and anxiety kind of go away. We know, again, how stressful and the uncertainty leads to that stress for all of you. We're well aware of it, and we're here to help each and every one of you get through this. As Dr. Rocco said, and I want to echo, we really are going to get through this together. We don't know how long we'll be operating under our current environment, but we know if we're all doing it together, we'll get through it together, and we'll get through it a lot less painfully, and most importantly to many of you and many of our businesses, a lot quicker. So keep doing what you're doing. Keep checking in on your neighbors, on your friends and family. Make sure they're okay. From the school district side, from the township side, we'll continue to keep you updated on things that happen each and every day, so you all have the information to best protect you and your families and get through this pandemic. So I thank you for your time in watching this video. I hope again that it's been helpful to you all in understanding the things we're doing here locally to get you through this, and appreciate your time and wish you all the best. Thank you very much.